Okay, good afternoon, Happy New Year. I know everyone's waiting for the designation of this year. Our motto this year is get her done in 21. So we're starting on that today. 2020 is officially behind us. We know that brighter days are ahead. And we're here to talk about a new way to move our state forward economically while we're beating the pandemic. We know the very first case, of course, was in Washington State. That was just short of a year ago today. We've all been clearing a path forward during these difficult days. We know that we are not where we want to be today. We remain concerned about the general status of the pandemic, and obviously we have new concerns regarding the new mutant strain, which appears to be more transmissible, that gives us added concerns. The current level of activity remains, unfortunately, very aggressive, and I am glad that Washingtonians are all banding together against this pandemic. No one has been left untouched by the forces of this pandemic, and many of us continue to suffer in many ways. So we are not out of the woods yet, but we do want to provide a path forward for economic recovery in our state. So today, to that end, we are announcing a new plan, we call it Healthy Washington, to move forward in 2021 once we see COVID activity reduced, once we see hospitals that are not overrun with COVID patients, once we see continuation of our efforts to wear masks to prevent the spread of this disease, and once we know that we're taking the measurable steps that are needed to beat this pandemic. So what we announced today will not be resulting in big significant reopenings today, but it is a plan so we can do that tomorrow when these conditions exist to allow us to move forward. This plan will go into effect on January 11th. It includes a small resumption of activity statewide. This includes live entertainment with very tight restrictions. We're talking about ticketing groups of 10, as well as certain fitness programs. There are some important differences I just want to highlight at the beginning between this roadmap and previous Safe Start programs. Right now, we only have 2 phases, but more phases will be put on the board when it becomes clear that we have knocked down COVID activity emphatically. And also a significant difference is that this will not be done on a county-by-county basis, but instead will be done by regions. We have found that because healthcare systems are regional, and we know that viruses do not respect county boundaries, we're moving to a regional assessment of criteria to allow increased economic activity. This makes sense not only from a public health perspective, but also from a healthcare delivery perspective. And on the screen here, you have a map of the regions. We have 8 regions. They're both based on health system resources over the geographic area. So their combined health metrics, we know, play an enormous role on what we use to track our progress. These are metrics that our partners are already familiar with that we will be using to judge when we're ready to reopen certain economic parts of our state. These are COVID-19 hospitalization rates, ICU capacity, case data, and test positivity data. All 4 targets will need to be met for the regions to reopen. And based on the metrics this plan is built on, every region in phase 1 today, every region will start in phase 1 today, given their metrics at the moment. There won't have to be any application process to move through to phase 2. It'll essentially be automatic, if you will, based on information regularly collected by the State Department of Health. So it'll be something that the numbers will tell the tale. So if I can go through these briefly, Lacy will have more description here in a few moments. So to advance a phase, a region will need to show that it has had a 10% decrease trend over the last 14 days. Also that it has a 10% decrease in COVID hospital admission rates over the same period, that the ICU occupancy rate is less than 90%, and that the test positivity rate is less than 10%. When a region moves to phase 2, Restaurants may reopen with 25% capacity as well as indoor fitness centers. In phase 2, sports competitions may resume with limited spectators, and wedding and funeral ceremonies can increase their capacities from current limits. And you can find what phase your region is in and how it's progressing on the website. We would now like to have some comments from Dr. Shah, who has been grabbing this opportunity and challenge with great energy, and I'm appreciative of him jumping in here and helping us with this effort. Dr. Shah.
Thank you, Governor. Can you hear me okay?
You bet. We've got you.
Good afternoon. So as Governor Inslee just mentioned, my name is Dr. Umair Shah. I'm the Health Secretary for the state of Washington, and I also want to bid you Happy New Year. It has been a challenging year for all of us, 2020, but as the governor has mentioned, our work is not done. We're still in the midst of this pandemic, and we remain concerned about this virus, this pandemic, and potential challenges that continue to be in the midst. And so I do want to say thank you to the governor, his team. I also want to thank our Department of Health team, and I also want to thank all of our partners on the ground that have continued to work with us throughout this year, and we know we're going to need to rely on you and lean on you even this coming year. As the governor mentioned, we're seeing some signs that disease growth has slowed for COVID-19. In fact, it has even leveled off in many communities across the state. According to CDC data, Washington State continues to have one of the lowest rates of COVID-19 cases across the nation, especially when you adjust the population size per 100,000. And together, we know that the restrictions that the governor put in place in November have been working. We are not out of the woods yet, but our case rates have started to come down, and we've started to see progress in both the healthcare system as well as the COVID numbers in the community. What the governor is announcing today, and we at the Department of Health are supportive of, is this path forward that allows us to balance the fight against COVID-19 and saving as many lives as we can with other factors such as reopening of the economy and getting as many people vaccinated as possible. As the governor also mentioned, that our real focus remains that we're in the winter months, and we know that we've got this third wave, the current wave, that continues to be very challenging for all of us, and that is going to remain the case until we see incredible amount of lessening, and that is what the Healthy Washington Plan and the reopening roadmap is all about. It is a regional approach, which is very important because we know that our lives are interconnected, that travel patterns and activity patterns are not just about what happens in one community or one county, but also more importantly in the healthcare community, that we are all connected. And we have a regional approach for that, which really follows a modification, but very closely to the EMS, the Emergency Medical Services regions throughout the state. And that really allows us to have strong connections so that these metrics, which look at, as the governor mentioned, hospitalizations and case data, as well as information related to what's happening in the community, it allows us to now see a path forward. We are not there yet as a state. We are all committed to getting there, though, as a state. And these metrics allow us information in communities, in the regions, to be able to make decisions on where we are and also to understand how we're going to be able to move forward. Again, as the governor mentioned, we are going to have this information on our website. The regions will have to meet all 4 metrics to go forward from phase 1 to phase 2. And we remain mindful of watching and working with our partners on the ground in the regions and the communities. Unfortunately, if regions see those metrics, 2 or more of those metrics start to go backwards, we unfortunately are concerned about increased disease progression, transmission, and the worry for diminished healthcare capacity, which means that we would have to move back that region back to phase 1. We as Department of Health are going to be monitoring these metrics on a weekly basis, especially on Friday, and then any movement forward or backward will take effect the following Monday. The final thing that I would just say before I close here, Governor, is that we really want to make sure that we are doing everything we can as a state to fight this pandemic. And that includes the messages that all of us have heard over and over again about wearing our masks, washing our hands, watching our distance, getting tested when we are needing to get tested. And obviously that means if you've been in close contact with somebody who tests positive for COVID-19 or you have symptoms, we want to especially make sure you get tested. And finally, vaccination. And we are going to be releasing some additional information about vaccines and the 1B category later this week. But for today, we want to make sure that Washingtonians remember that we do not want to fear COVID-19, but we have to respect COVID-19. It has been a formidable foe throughout this last year. We've got to do everything we can to continue to move forward. So again, we're not out of the woods yet. We want to make sure that we continue to move on a good path forward, and we want to do everything we can to help keep Washington healthy. So thank you for all your efforts. Happy New Year to you. And Governor, I'll turn it back over to you.
You bet. Thanks, Dr. Shah. You know, the metrics that we have chosen here are designed to give us a path forward, obviously. They're based on multiple factors. We've learned a lot about COVID in this pandemic, and we are adjusting to it as we go using the latest scientific information. So we have added metrics to our assessment protocol. It is a more sophisticated tool, and I hope to be a more successful tool. And so to talk about that, we have DOH expert on this, Lacy Fehrenbach. Lacy, could you help us walk us through this?
Thank you. Good afternoon, everyone. As you've heard, the roadmap to recovery uses multiple metrics, and these combination of metrics give us information about the disease burden and trajectory, as well as the health system capacity. And by using multiple metrics, we can increase our confidence in how we're viewing the situation and really determining, is it improving or worsening in a given region. The metrics will govern bidirectional movement between these two phases. So as you've heard, you need to meet all 4 metrics to go forward from phase 1 to 2. A decline of 10% or more in COVID case rates in the most two recent weeks compared to the prior 2 weeks, so the 2 weeks before the most recent 2 weeks. And similarly, a 10% decline in the COVID-19 hospital admission rate. Again, 10%. ICU occupancy needs to be below 90%, and this is COVID and non-COVID patients. We want to make sure our health system has the capacity to treat anyone who needs a high level of care. And then your test positivity is below 10%. To remain in phase 2, you heard that there is a little bit of flexibility here. Regions must continue meeting at least 3 metrics. And the ICU and test positivity metrics are the same as the ones we're using to move to phase 2. However, the trend metrics have a little bit more flexibility within them. Regions will meet these criteria if they have declining or flat case rates and declining or flat trends in hospital admission rates. If a region does not meet at least 3 of the metrics for remaining in phase 2, they will be moved back, as was mentioned. The flexibilities to stay into when not meeting a single one of the 4 metrics, and the flexibility to allow for flat case and hospitalization rates are intended to create more stability in the system, especially early on when a region moves forward and there is an increase in people's mobility or activity levels. I want to emphasize that it's really essential that communities and regions remain proactive on the key mitigation measures that Dr. Shah mentioned, wearing masks, watching our distance, washing our hands, and that they ensure ready availability of testing with timely contact tracing in order to stay ahead of the pandemic and stop chains of transmission. DOH will start posting the analyses using the most recent complete data this Friday, and any movement would take effect the following Monday. Regarding what is allowed between the two phases, we've tried to bring more consistency to activities that are allowed and how they're allowed in a given phase, taking into consideration factors like if an activity is indoors or out, if masks can be worn, if distancing can be maintained, or if there's risk for close contact, crowding, or other factors. As noted, we're starting with a two-phase plan, and we're just beginning to turn the corner on our third and largest wave of COVID. We may need to adapt this plan as we go forward and we learn more about the pandemic or as more people are vaccinated. Most importantly, our ability to remain on this path forward towards recovery relies upon each of us and our actions as individuals and collectively. As noted, we're not out of the woods yet. I really want to encourage Washingtonians to keep up those 3 W's, limit your gatherings, and help us keep Washington healthy. Thanks. Back to you, Governor.
Thank you, Lacy. This has been a lot of work designing this. I want to thank you for your expertise in doing this. I think this is a sophisticated tool to help us make good decisions for multiple reasons. I wanted to make a comment about our vaccine efforts. I know there's intense interest in this. We're working with our partners, and we have multiple partners moving forward to do this as efficiently as possible. I wanted to share with you an encouraging conversation I had this morning with quite a number of CEOs of our hospitals. And of course, our hospitals are integral to our vaccination plan. And I wanted to get from them an assessment of our current vaccine rollout strategy. And frankly, I was encouraged what I heard. Just to share some of the information they gave me. The Confluent system in Wenatchee has already administered 96% of its doses it has on hand. Yakima Memorial has administered 87%. CHI Francisco has already administered about 70%, and Swedish is at about 67%. These are encouraging numbers, frankly, because some of the other numbers we've seen are significantly less than that. And what we think is going on is we've had a delay in the entry of some of this information into our state system. So getting the information right from the horse's mouth, so to speak, and that's the CEOs, has actually been encouraging to me that we're getting this vaccine into people's arms and in a meaningful way. That does not mean that we have some improvements that we are pursuing. We're looking for ways to have a more efficient way to move vaccine from one hospital to another if there's an excess supply. We're looking for ways that might make it easier for hospitals to stand up mass vaccination units that are not on the hospital location. And we're looking at multiple ways to be able to do this. So we are working to try to accelerate this program, but what I heard today was actually very encouraging that we are moving forward. Now, obviously, this is only as good as the dosage we get from the federal government, and that is controlled by the federal government. There are concerns the CEOs expressed that the delivery schedule has not been predictable, and that has made them difficult for them to schedule large clinics. We hope we can do whatever we can to encourage the federal government in this regard to be as timely and as regular in their information they provide to us. We'll continue to encourage them in that direction. So I do believe we're going to have continued progress in this regard. Tomorrow, the Department of Health will provide further information about the prioritization and the criteria we will use in this regard. And I look forward, and I know many people will look forward to their announcements. We know people are intensely interested as to when they will be able to get the vaccine. No one has dates yet, but we will provide, the Department of Health will provide a phase finder system on the internet so that you can basically type in your criteria personally, and it will tell you in general in what phase that you will be in based on that personal criteria. It will also notify you when those phases occur. So the reason I'm sharing this with you is I've had some inquiries for people to say, how do they get on the list? Well, there is no list of individualized names in the state of Washington right now that you have to worry about. People do not have to worry about applying or getting on any particular list at the moment. We just need to have the vaccines go through the first priorities, which are our healthcare workers and our people in long-term care facilities. And those are the two priorities at the moment. And those programs are moving forward. We will then move on to a series of phases of other priorities, and the Department of Health will articulate those tomorrow. But I can assure people will have plenty of notice when we reach those phases so that you'll know when it's time to go actually get your vaccine. And that will be up. It's not up today because it doesn't need to be up today because, again, we're going to be for some period of time in the first phase, which are healthcare workers and long-term care workers. I do want to note that we have had success moving some of this vaccine around to places where it's most needed. There's been some challenges on this because the Pfizer vaccine is only given to us by the federal government in lots of 975, and that's been more than we've needed in certain places. So we've made sure that we can move those to the places where they are needed. So the statewide curve of the COVID-19 spread does not appear, thankfully, to be worsening right now. And I want to note why that is. There is a reason for that, we believe, and that is because of the tremendous effort of Washingtonians in so many different ways. The survey's results have shown that we have been one of, if not the most compliant state in our efforts to be safe around the holidays. More people as a percentage stayed home in Washington and didn't mix socially over the holidays that would have created a pandemic surge than perhaps any state in the nation. There's data to show that. We know that we've had a very strong compliance, difficult as it has been with businesses. Listen, it's terrible when a business can't be open because of the pandemic. I feel that. I think all of us should feel that for the employees and the business owners who've had to go through this terrible time. It's one of the reasons we've been committed to contributing over $100 million for business relief, and there will be more to come. But the fact of the matter is that this diligence by Washingtonians, both in their personal lives and their business lives, has paid off. Just to give you a sense of how helpful people have been, 99.9% of the restaurants and bars in the state of Washington, we have not had to take compliance action against. And that's really encouraging that people have made these difficult decisions to follow the law and save lives. And that's what we're doing. We're saving lives here, not by the single lives, not by the dozens, not by the hundreds, by the thousands. The reason I say that is that I can thankfully tell you that we have a less infection rate in the state of Washington than 45 other states. Let me repeat that because I have yet to see this in print. Somebody could win a Pulitzer on this. 45 other states have higher infection rates than we do today, and this is a mark of success of the actions of state of Washingtonians that have operated jointly out of a sense of compassion and responsibility. As a result, we have a fatality rate in our state that is less than half the per 100,000 rate across the state of Washington. That rate is 106 deaths per 100,000 population. We're at 45. So if you do the math, we have saved thousands of lives because of the investment we are making in ourselves, in our individuals, and in our communities and our family members. It is paying off big time. Difficult as this moment is for us all. And we intend to continue our efforts to be vigorous in saving lives in 2021 as we were in 2020. Those lives are just as precious in January 2021 as they were in May 2020. So we know we can't reopen every business today. We have provided a roadmap about how to do that. I've had good discussions with legislative leaderships about potential help for businesses and employees moving forward. I hope that those will be productive early in the upcoming session. And we're glad that the federal government has finally stepped in to provide some relief as well. So we're looking forward to these continued efforts. And with that, I would be happy to stand for questions.
Governor, can you give more specifics on what type of live entertainment and fitness will be allowed next week under this plan? And given the early concerns about singing and contagion, what went into deciding to allow that but not limited indoor dining during this first phase?
Lacy, do you want to give them more specifics on that? I know we have it on a chart there before you. On the entertainment, there's a limitation of individuals, I know. I'm trying to recall what it is, actually. Or Nick, is Nick on the call?
Mm-hmm. Yes.
Nick, could you respond to those questions, please?
I'm happy to, Governor, and I see Lacy's got her camera on right now. Lacy, would you like to go, and I'm happy to supplement?
You can start, Nick.
Wonderful. So the limited reopening of fitness activities the governor mentioned is that in phase one, when the regions begin on January 11th and start out in phase one, there will be some very limited fitness activities allowed in each of those regions. So for example, appointment-based fitness and training at gyms where no more than one customer or athlete per 500 square feet is allowed. So that's a severely limited reopening of fitness in phase one for those regions because we absolutely recognize the connection for individuals between their their physical health and their mental well-being and the stress that COVID is creating in many people's lives. So we thought that was really important to go ahead and make that little bit of movement in phase one. Once those regions make it to phase two, at that point in time, those fitness activities are allowed to resume at 25% capacity. In regards to live entertainment, this is just a modification or really a doing away with this blanket prohibition we have had on the concept of live entertainment in any venue or any place at all. What we're moving to is placing restrictions on, uniform restrictions on those venues themselves. So for example, if somebody wants to play the piano in the corner of the lobby at the local hotel, that's currently considered live entertainment that would not be permitted under our guidelines, but under the new form of restrictions, that type of live entertainment would be allowed to continue.
And this really goes towards the balance of mitigating disease spread and taking a pretty cautious approach to bring people the opportunity for physical health, the mental health benefits that go along with physical activity, and participation in the arts. We have taken a very cautious approach here, as Nick mentioned, in terms of ensuring spacing, requiring mask use for any indoor activity, including sports, fitness, singing, etc., where possible, and really trying to build a slow, gradual return to doing the things that bring us joy in our lives and provide us other health benefits.
Next question comes from Ryan with the Seattle Times.
Ryan, could you defer? Ryan, could you defer just for a moment? Yeah, I'm sorry, Ryan, go ahead.
All right. So currently, do any of the regions in the state meet the criteria to move to phase two? And then is there a tipping point where a region could be rolled back if another surge hits a region?
So none of the regions currently qualify for movement to phase two. And yes, if there is a worsening, a backwards movement under the criteria that Lacy described, that a region possibly could go backwards, we obviously hope that that would not be the case. Listen, we have had some recent, what I would consider good news is some of these numbers coming down, but they're not down at the level yet or at the rate that is necessary. But I'm very hopeful that the continued efforts that we're making are going to continue that improvement, and this does provide a pathway that on a sort of scientific criteria basis, this reopening can happen. And we're hopeful that that is going to happen. And we've done this for two reasons. One, we've created a larger, richer, more robust evaluation system of these metrics rather than just relying on one or two. And secondly, we wanted to give people a vision as to what would need to happen to actually reopen so that people have that vision and understand the rules of the game, if you will. So we hope that this will be helpful to people.
Next question comes from Simone with Q13.
Hi, Governor. My question is about vaccines. You recently expanded the 1A group to include all healthcare workers to be able to get those vaccines out to people. But there's a lot of people coming to us in different communities who now qualify for the vaccines who have no idea how to go about getting them. Are you working to improve the framework for this so they can have some answers since they do in fact qualify?
Well, yes, we are, and we made some progress on that with our hospital leadership today. I would encourage people as a first stop to call a local hospital or go there physically if appropriate and don't cause problems if you go, but to check out a hospital setting and your local public health local office and checking with them as a first stop. The CEOs indicated that they are most willing to provide community access to people, and we appreciate that, outside of their own employees, and they are doing that to considerable numbers, and we talked about ways to expand that. We also talked about a way to possibly make it easier for them to do that, and there is a regulatory change that we are trying to figure out right now if we're allowed to do this, to make it easier for them to do this in a variety of ways. So we hope to have an answer for that in the next few days. So start with your local public health, go to your most local, your hospital, and we'll have more information in the days to come.
Next question comes from Laurel with the Spokesman Review.
If I may, let me just share one other thing that some of the CEOs suggested too. It would be helpful, and this is a situation where all of us can help in this effort. This is an enormous undertaking, of course. If all of us can find a way to pitch in. One of the ways people could pitch in is, let's say you work at a dental clinic. It might be useful for that dental clinic to talk to other dentists in the area and have them all sort of go together to the local hospital and say, hey, we'd like all our folks to be vaccinated. In fact, we'd want to do it ourselves because dentists can give vaccinations as well. To the extent that these local smaller entities can band together to work on this project, it would be really helpful, and we encourage their leadership. Anybody in the healthcare field can be a leader to find somebody themselves who can do the vaccination. So the more that people work together in these alliances, the more efficient this will be. The one thing too, I just have to say, look, this is going to be a time where this is not going to get done on the first day. It has not got done on the first day, but the progress we've made to the numbers I've shared with you are actually quite encouraging as we move forward.
Laurel, go ahead.
Hi, Governor. So I also have a question about the vaccines. We're starting to see that some rural health districts.
Could you excuse me? I'm really sorry. I can't believe I didn't talk about this. Look, if you're looking for the vaccine, call your healthcare provider. That's the first stop, actually, before your local hospital. Contact your healthcare provider and ask them for their advice. They may be able to administer it, or your local physician, your physician's assistant, your dentist. That's the first stop to check with your local folks. The pharmacy.
Governor,
Yeah,
if
go
I
ahead.
can just wanted to interject between Simone's question and this one here, is that we just want to remind everybody that right now the criteria that we've opened up, that initial phase is for healthcare workers and those staff and individuals that reside in long-term care facilities. The governor is absolutely right. When we now move to the next phases, which is going to happen in the state of Washington, then it's really going to be important for that continued connectedness with the healthcare system, your healthcare provider, if you have one. If you don't have one, to make contact with, again, whether it's a hospital or a public health department. And the governor had mentioned the discussion with the healthcare system today, the hospital CEOs. We also had a discussion with the local health jurisdictions today. And I just want to say that we're working hand in hand with both healthcare and public health, as well as community partners. Thanks, Governor.
Thank you. Really important point. You can't reiterate, this is a fairly discrete number of Washingtonians that are eligible at this moment. And they are the ones that who are in a position to be able to get the vaccine today. But if you work in a healthcare setting, your employer can also be of assistance to help their employees become vaccinated. And we would encourage employers to help in that regard, to help their employees in this location effort. And the more they work jointly, the more successful that we will be.
Laurel, go ahead.
Yeah, I guess along those lines, we're starting to see that some rural health districts have the majority of their people in phase 1A vaccinated, but larger metropolitan areas aren't necessarily experiencing that. So I'm wondering if you could you or Dr. Shah could talk a little bit about, I guess, whose job it is in each county to ensure that everyone who is eligible to get vaccinated is getting that shot, especially in those larger counties where it may be more difficult to figure out kind of who's considered that high priority.
Doctor, you want to take a stab at that? And I have some comments.
Sure. Thanks, Governor. Thanks for the question. It really is a coordinated effort with our healthcare partners and public health. We want to make sure that we're supporting at the state with guidance, with resources, with information, technical assistance, all of that together. But really at the local level, it becomes a combination of, again, right now, because we're at 1A in many jurisdictions are still working through 1A, meaning all the healthcare workers, that it's really the hospitals and the healthcare system that are taking the lead, but they're also being supported and at the ready by the local health departments. And so this urban and rural piece is something we are definitely aware of. And as the governor mentioned, we're also working with those partners on both levels, both sides, I should say, healthcare and public health, to really come together and make sure that any of those challenges, including if it means that at some point we have to think about potential working together or transferring, that those are the kinds of things that we're working together as a state and local partner dynamic. Governor.
Yeah, no, I don't have a lot to add. I guess what I would add is that all of us have some role in this, all of us, including ourselves in our individual efforts. Employers have a role. If you're a physical therapist clinic and you've got 20 employees, talking to them about the best way to get them vaccinated makes sense. If you are a hospital administrator, showing leadership to provide vaccination services to those in your community, we've asked them to do that. They've taken on that responsibility, and we talked today about ways to make that easier. So all of us have some role to play in this regard. But this is a discrete number of people. We know who they are, and I'm fairly confident that we're going to get this job done. Like I say, I'm a lot more confident today than when I went to bed last night, seeing the numbers that are actually happening in the real world. And as I've said, the numbers we've got are quite encouraging from the CEOs of these hospitals that are somewhat different than the information that is currently in our reporting system. And apparently the reason is that there's a manual entry system that takes some time that has delayed our reporting system. I talked to one hospital that is, well below 100% today, but actually their concern was not so much they weren't getting into people's arms, but by Friday they'd be out of doses if they didn't get another shipment. So things are moving apace.
Next question comes from Essex with Cairo 7.
Yes, Governor, I spoke today with a woman whose husband lost his job as a tennis pro, even though his work is outside and socially distanced. She was in tears about the loss of income. Would your new system allow him to go back to work in phase 1? And also, Mr. Secretary, would you discuss the situation with vaccines and your assessment of whether one dose should be allowed as vaccines in order to speed up the delivery of vaccines to people?
Nick, could you address the recreational issues?
Yeah, absolutely. Thank you for the great question. So in the tennis example, tennis would be permitted to reopen in phase 1 because it's designated as a low risk indoor sport. So in that particular example, tennis would be reopened as an indoor activity in phase 1.
She should thank you for that result, too, Essex. Dr. Shah?
Yeah, thank you, Governor. Thank you, Essex, for the question. So we are definitely looking at this issue. There are very good, smart people on both sides of the equation of looking at whether one dose and halving the dose, if you will, not doing the 2 doses, and really going with just 1 dose of either the Pfizer or the Moderna vaccine, and then trying to vaccinate more people. I am right now not in favor of that. I do not believe that is the way forward, at least with the information that we have available today. Now that may change over time, but right now I believe the main focus should be to get vaccines to our partners so that they can administer the vaccines to as many Washingtonians as possible. First goal. The second piece of this is that the trials that were done, the clinical trials for both Moderna and Pfizer that showed for Pfizer 95% efficacy or effectiveness and the 94.1% for Moderna vaccine, those both were with the understanding of 2 doses. And that means that, as the governor mentioned, even with this variant that we're watching, we don't want to get in a situation where we somehow don't give that second dose and we are putting people at risk because they're not fully immunized or fully protected from the vaccine. So right now, I'm still in favor of a 2-dose regimen. Again, we're watching this. We're talking to partners across the system, especially at the federal level, to really understand if there's any change in guidance, and also looking at what the science is about this. But again, if anything changes, we'll let you know, but right now it's 2 doses.
Next question comes from Jerry with the Everett Herald.
Happy New Year, Governor. I had a question. I think probably Dr. Shah or Lacy Fehrenbach could help. Could you clarify the timing of this new Healthy Washington plan? It appears that the first day a region could go to phase 2 is January 25th. So I wonder if you could clarify the timing and elaborate on what's envisioned with the mass vaccination sites. What might they look like and where might they pop up?
I can start on the timing. So regions would be eligible to move starting this coming Monday, the 11th. We will run data this Friday with the most recent data that we have, and then if anyone qualifies, if any region qualifies to move forward, they would be able to do so on Monday. We will run analyses every subsequent Friday for the months ahead, and county regions will move back or forward accordingly to their metrics.
If I can address the max vaccination site, so this is not a decision we have made yet. we think there's a significant chance, probability, that the current medical system and locations will be adequate to the task, but that is still something we're evaluating. And if we do, we've already talked about some of the things we could do to make it easier to stand up such facilities. We don't believe they're necessary at the moment for the limited prioritization that we have today of the healthcare workers and the nursing home workers. It seems to me that we're making adequate progress to get that done. But we are considering for the later tiers the necessity of that, and I've already started to think about what might be necessary to stand those up to make those easier.
Next question comes from Keith with Como 4.
First question goes to Lacy and for the governor also. But Lacy, as far as the what Jerry was just talking about, based on today's analytics, are there any regions that are poised to move up to phase 2 on Monday? And for the governor, you've had 9 months to figure this out. Why did you get caught off guard in getting the vaccine rollout?
Well, let me just take that. We weren't caught off guard. We have been delivering tens of thousands of vaccines. I just shared with you information, and maybe you missed it, that Confluence has administered 96% of their vaccine. Yakima Memorial has administered 87%. CHI Franciscan has administered 70%, and Swedish has administered 67%. There's been very substantial vaccination activity going on in our state. So I'm glad that we're doing this. I think this vaccine is a bit of a medical miracle, and we're celebrating it, and we're getting it into people's arms in mass quantities. But we are continuing to work out the wrinkles in this system to accelerate that even more. And that's important because no system in human knowledge that I am aware of has ever started a process of this dimension and not had wrinkles that you're ironing out. And that's the process we're going through today. And as I indicated, talking to the hospitals gave me more confidence in that regard. The long-term care facility is something that the federal government contracted with pharmacies to do the long-term care facilities. So that has not really started at huge scale yet. We're eager for that to start up. That is something that's largely under the control of the federal government because they contracted that portion out of obviously our most susceptible citizens to the pharmacies. So that part of it is largely under the control of the pharmacies and the federal government. But I think we're making good progress on the vaccine. There was huge planning that went into this, and we will continue to improve this system on a daily basis, and I think we made progress even today.
Next question comes from Austin with Northwest News Network.
Yeah, Governor, Dr. Shah, I am wondering about whether Washington has yet seen a case of this UK variant, and if not, I would imagine it's just a matter of time. And given what's happening in the UK, while today you're talking about the potential for reopening, what is the potential for broader restrictions on all of us if and when this variant arrives?
Governor, let me just start, and then I'll turn it to you for the second part of that question. The answer is that we are, with the testing data that we're getting at, the truth is that we're looking for the strain, but we have not found the strain thus far. Now we have to just put the disclaimer that we do not across the country have as many of the capabilities as the UK has as a nation in terms of doing the molecular testing that really was fantastic in their ability to identify the strain that they found in the United Kingdom. And they took then strong action, which included letting all of us know, which is where Governor, as you remember before the holidays, required the mandatory quarantine for the travelers that were coming directly from the UK. So I just want to put out there that we are looking. We have not found it thus far. That said, with what occurred in Colorado, and obviously we've seen strains in other states and even in Canada, the real concern is that it's a matter of time. And so really, what does this mean for all of us? It means that we have to double down on two things. One is actually three things. One is we have to double down on all the preventive measures. Number two, we have to double down on making sure that the right people are getting tested. And number three, we have to double down on our measures to vaccinate. So all three of those are absolutely key to this. And certainly if that or as that changes, I'm sure we're going to continue to provide additional guidance with respect to that, not just as a state, but as a nation. Governor?
Listen, there is no way or value really of speculating, what could happen if this goes south. But obviously, anything is possible in this regard. But as I've indicated, we've had substantial success in Washington. We have a group of people in Washington that largely follows science and cares about their families and have been willing to follow the law, and those things have been very successful. And I would hope they would continue to be successful. Now, that is not to mean that you get thrown by curves. Keith asked about, why we don't have 100% of doses in people's arms yet. Well, we got cut by 40% on our first dosage from the federal government. We didn't anticipate that, nor should we have. We've had 30% of people in healthcare been reluctant to take the vaccine, which is surprising and disappointing to us at this moment. So we need some more individual people stepping up here too, with a very safe, very well tested, very well confirmed safe vaccine that is now in hundreds of thousands of people with proven effectiveness and safety. So we need to increase the number of people who are willing to take the vaccine, even in the healthcare delivery system. So there are some things that we did not anticipate, and I'm sure there will be others as well. But what I'm confident of is that we have people in the state of Washington who believe lives are worth saving and are smart enough to know how to save lives. And that means socially distance, get vaccinated, and help us beat this pandemic. I'm very confident that's who we are as a state.
We have time for a few more questions. Next one comes from Mayor with KXLY.
Hi, Governor. We're just wondering how these certain regions will be impacted by local prisons who are seeing high case counts. For example, here in Spokane, we have the Airway Heights Correction Center, which has the outbreak and impacting local data. Will that impact these regions trying to move forward?
Well, I believe so, and maybe I can ask Lacy to confirm that. There's no exclusion for people in custody. Is there, Lacy? Help me out. I don't believe there is.
That is correct, Governor. The case rates will include all people living in the region, including those people who are incarcerated. And I do want to remind everyone that we're looking not at absolute case rates, but decline, plateau, or increase in those case rates in the most recent 2-week period compared to the prior 2-week period.
I want to express our concern of these cases that are in our prisons as well. We would like to eliminate the risk of this disease everywhere, including in our prisons. I know that there's been great effort to try to reduce the risk of the spread, but these are very difficult environments, as people know. I am happy that our fatality rate, infection rates are in the better half compared to other states, but we'd obviously like to continue our efforts to reduce the risk to these folks who are incarcerated. We know their families care about them. We know they're worried about them. Those worries are very legitimate. And we've directed our DLC to be as intentional and mindful as possible to reduce this risk.
Next question comes from Hannah with Cairo Radio.
Hi, Governor, and I'm wondering if this would be for you or the health secretary. There's been a lot of struggle getting the data to be accurate over the last probably couple of months where we've had some lags in the data. I'm wondering, is there anything being done or that can be done to make sure that there's accurate data being used for the counties to get to the, or for the regions to get to the next phase?
I don't think that we have, when I'm thinking of the criteria, there's nothing in these criteria that I think we have flaws in the data. I'm thinking right now. So I think we're in good shape to have a very credible way to assess this on a regional basis. I also, one of the good things, I think the department has been very transparent about where there are questions about the data. We share that with the public. And I think that's really healthy too. But at the moment, I think the data, at least from my perspective, I have confidence in it for the 4 criteria that are now very important. For instance, there's been some trouble getting a couple of the points, but I don't think that they're in a meaningful way going to affect this situation. Lacy, do you have anything to add to that?
Governor, yeah, okay, go ahead, Lacy.
You can go ahead.
I was going to just reiterate what the governor said. I wasn't sure if you were unable to get off mute, but I was just going to reiterate the same thing. The 4 metrics that we have confidence in those 4 metrics. As far as data and in general goes, I mean, that has been a challenge across the country with making sure that there has been strong, accurate, reliable, and timely data. And certainly that's something that we continue to strive for in the state of Washington. But as far as these 4 metrics go, Governor's absolutely right. We have no reason to know of any concerns about the metrics that are being used. I will say one thing, which is that the test positivity rate is something that we continue to monitor. It is for the PCR testing. I do want to make that mention because it's really for the nuclear testing, PCR testing. It does not include antigen or antibody testing. And I think that's an important distinction just to make sure everybody is aware of that because obviously when you start to get into antigen antibody testing, it starts to become a little bit more murky. And that's why we wanted to be confident on the data that we were using. Lacy, did you want to add anything to that?
You covered it well.
Final question comes from Dylan with KAPP.
Hi, Governor. How would you respond to the Eastern Washington restaurant owners who say they're following more safety guidelines than a grocery store but still haven't been able to open?
Well, what I'd say is we're in the business of saving lives, and we know that saving lives entails reducing risk, and we know that one of the most riskiest environments is when people sit across the table and for an hour and a half and dine together and enjoy each other's company and cannot wear masks. This is a central fundamental tenet. It's a little bit surprising to me people don't sort of figure that out on their own. People wear masks when they go to grocery stores and they don't sit next to each other for an hour and a half and breathe on each other. It's a very, very different environment. It's hard to think how much more different it could be. And the fact of the matter is the reason we love restaurants and the reason it is such a joyous part of our life is because it allows us to be intimate for a considerable period of time and not wear a mask, because you can't wear a mask and eat. And until we design a technology that allows you to wear a mask and eat, we have this problem. And it's not the restaurateur's fault. It's a fault of human physiology. And that risk is too risky right now in many of these regions. Now, we have set forth a path that will allow them to reopen as we knock these numbers down. And the sooner we knock them down, the sooner we'll get these restaurants back open. In the interim, we've got to show as much care as we can for the employees and the businesses of these restaurants, which we're doing by having over $100 million of relief that I have made sure is going out the door, and I believe there will be more coming in when the legislature gets back into town. So that's the fundamental difference. It has to do with risk and saving lives.
Any final words, Governor?
No, I want to thank everyone again for their continued commitment to our own health. As I've said, what we're doing is having a huge impact on people's lives. And one of the things, it's funny, I went for a walk the other day, and I saw some couples walking by, and they happened to be people of a certain age, like my age. And And I was thinking about them. They're, you know, I saw some people probably in their upper 60s, 70s, 80s. And I was thinking, you know, that couple may be alive because some of the things other people have done in Washington, wearing masks, avoiding social distancing, and you don't know who they are. And the things we're doing today together are saving lives. We can't identify them, but we know that they're out there by the thousands. And so as we talk about becoming vaccinated, as we talk about the decisions we're making in our individual lives, as we celebrate the fact that Washingtonians were more heads up, more observant, more successful perhaps than any other state in the United States last year in avoiding Thanksgiving, and we hope holiday surges. As a result, we have 45 other states in worse position. As a result, we've saved thousands of lives, and we hope that people celebrate that accomplishment at the same time, which should give us some meaning to what we're doing of this tension and anxiety we're feeling. There's a reason for what we're doing, and that reason is life itself, and I think it's a worthwhile pursuit. And today we've fashioned a way to hopefully reopen businesses as we continue to succeed on that. So I hope everybody heeds the motto of this year, which is get her done in 21. Thank you very much.